Hello, good day everyone. I am Nikki Tejadillo and today I will be performing the immediate newborn care return demonstration. So immediate care of the newborn helps to identify whether the baby has a normal condition or has a condition or problem that requires urgent rapid treatment or has a condition or any malformation. So before proceeding the procedure, so first we have to wash our hands to deter the spread of microorganisms. And then we're going to prepare the needed materials. So it includes our gloves, the sterile gauze pad and the cord clamp, alcohol, and the cotton balls, kidney basin, thermometer, scissor and the forceps, our medication which is the vitamin K and eye ointment, the tape measure, and as well as the baby's clothing. So preparing all of these will help us to conserve our time and energy. Now we're going to identify the infant through his wrist tag. Okay. So this is to make sure that, to verify that we give the care to the right infant. And then we're going to enhance the infant's comfort by keeping the environment warm. So like we have to off the aircon. This is to prevent the hypothermia. Then now we're going to wash our hands again before putting our working gloves. This is to deter the spread of microorganisms and also to avoid any cross-contamination. So now we're going to weigh the newborn correctly. So this is one of the important indicator of health, and also this is to identify the presence of any complication. Then after weighing the baby, then we're going to proceed to the cord dressing. So we're going to put the sterile gloves first to prevent any contamination. And then we're going to properly restrain the baby upper and lower extremities. So this is to lessen the movement of the baby. And then now we're going to use the cotton ball that's soaked in the alcohol. So we're going to disinfect the umbilical cord from the base to upward. So this is to protect the umbilical cord from the microorganism. Okay? So we're going to disinfect base from the upward, then discard. Okay. Next, we're going to place the sterile gauze pad at the base of the cord, and then we're going to clamp the cord with the umbilical clip at least 1/2 inch from the base of the cord. So clamping will help to stop the bleeding from the blood vessel to the umbilical cord. And then we're going to put this. Okay, and then we're going to cut the cord about 0.5 centimeter. First, so we're going to put this umbilical cord clip, and we're going to express the remaining blood from the cord, and then with the gauze pad we're going to place it to the base of the cord. So this one. Then we're going to cut it. Now we're going to place the gauze pad. So we're going to place the gauze pad at the base, and then we're going to put or pour 70% of alcohol to this is to avoid any contamination. Okay. Then we're going to proceed to the vitamin K injection. Vitamin K is needed to form blood clot and also to stop the bleeding. And now we're going to withdraw the exact amount of the vitamin K. So from the ampule, and then we're going to inject the middle third lateral here in the part of the left thigh of the baby, because the muscle here is thick and well developed. Okay. So we're going to and now we're going to carefully get the tape measure. So we're going to measure the head, chest, and abdomen circumferences, and also the length of the baby. So let's start from the head. So it is 8 inches. Now we're going to take the newborn's temperature rectally to check the body temperature and also to check the patency of the baby. And then next, we're going to proceed to the initial bathing. So now we're going to hold the newborn in a football grip manner, so like this, so that the water will not enter to her ears while bathing. And now we're going to carefully wash the newborn's head. Okay, so with the use of also the baby shampoo and or baby soap. Okay. So this will moisture the skin of the baby. Okay. And then we're going to dry her skin and hair after. Now we're going to remove first our wet gloves. Now we're going to dry first the baby so that we can prevent the irritation from the soap or the shampoo. Now we're going to put the newborn's diaper, the shirt, mittens, and also the utes. So this is to provide warmth and comfort to the infant. Okay. Then I'm going to put the clothes. And then now we're going to wrap the newborn securely with a clean blanket, and so that the baby can resemble the warmth of her mother and to help to soothe the newborns. Okay. And then now we're going to place the newborn in the crib with a drop light, and we're going and attach the crib tag. So now we're going to apply the CREDS prophylaxis. So we have to shade the newborn's eye, and then from light and open one eye at a time. So by exerting a gentle pressure on the upper and lower lids of the baby. So if a bright light is directed toward the eye, so it means that she has a definite response. So this is also to make sure that the structure, the size look normal. Okay, and now we're going to apply the ophthalmic ointment from the inner to outer acanthus. This is to making sure that the tip of the medicine tube is not touching the eye of the newborn. This is to protect her eyes from getting bacterial eye infection. And also, we have to be careful to prevent any eye injury. And then to the other eyes. So now we're going to take the newborn's vital sign. This is to ensure that the baby is develops normally. So we're going to check her heart rate. And now we're going to do the aftercare of the equipments that we use to reduce the transmission of the microorganism. And then we're going to record the procedure done and other the data to because the documentation purposes that procedure was done and means or communication. And then we're going to answer the related question of the procedure. So as I check the data of the newborn, the vital sign is the temperature is 36.1 centimeter, her heartbeat is 130 beats per minute, and the blood pressure is 64/41, and the circumference in the head is 10 inches, the chest is 11 inches, the abdomen is 11.5 centimeter rather, and then the length is the 18 inches. So that's all the newborn's care return demonstration.